Well, I'm not a political activist by any means, but I am passionate about a lot of things in politics. When my wife told me we were talking today, can you hear me? When my wife told me we were talking today, I thought about what I could say that would be at all meaningful. And the things that I came up with is why they had the original Tea Party, and that was because of usurpation of liberty, like this sign says here, by taxation, over-taxation. Those original Tea Partiers were not asking for free anything. They wanted freedom. They wanted the opportunity to make their own lives. And now we've kind of allowed ourselves to get into a position where, where the government is trying to give us everything. And I think to have a discussion about healthcare policy, to discuss, well, maybe we could do it this way or this way, I think you've lost the battle. The battle really is at liberty. It's not what the government can provide and how they can provide it. If you're doing that, you're arguing about a better way to do socialism. And as we know, Ronald Reagan did not argue about that. It's not about a better way to do the government program. It's about whether the government should be in that program at all. Yeah. And I would tell you, it's not the government's place. The other things I thought about, apart from just simply that we need to defend our liberty as American citizens, is that we hear a lot about, what's the word? I'm blanking. You're making me nervous. About rationing. Talk about rationing in healthcare and how we probably all think that rationing sounds bad because the government's going to be telling us when we can have medical procedures, when we can have this or when we can have that. People on the left would tell you that rationing already happens, and that's true. If you think about it, each of us in our own personal lives have a finite amount of money. So therefore you ration what you spend your money on. But the point is that you make that choice. You make that call. You prioritize what is important to you. When you go to the store and want to buy something, you don't say, call your congressman and say, well, I'd like to buy a toaster, and could you buy it for me? He's going to make that decision for you, and if he's going to make that decision for you, he's going to pick it out for you. He's going to tell you what your priorities are. That's not the way it should be. It should be your priorities. It's your money, and the same way in healthcare. Throughout my medical training, which seems like a long time now, I spent a lot of time in VA hospitals. I recently heard a congressman from California, or congresswoman from California, talking about what a blazing success the VA system is. Now, I won't say that the VA system doesn't have some good things about it, but in my experience, if you want to see the closest thing we have to socialized medicine, it's in the VA system. And I think it's a travesty because the veterans certainly deserve better. I mean, we have a lot of veterans here today. I'm sure that as an orthopedic surgeon, I would see these good old World War II veterans in clinic, and they had hip pain or knee pain, and they wanted a total hip or a total knee. And just because of how the VA system is set up, where we were, and this is both in medical school and in residency, if I saw someone and said, you know, I think you need a total hip or a total knee or some surgery, whatever kind it was, they'd say, oh great, well when can I sign up? When do I do it? And ultimately, I had to tell them kind of regretfully that, well, we'll put you on the list. It'll probably be 6-8 months before we call you back and bring you in to schedule the surgery. And so just by the very fact that the VA had a limited budget, they had to cut costs somewhere, they only had so many surgeries they could perform in a week, it got rationed, and therefore those patients never had any choice as to when and how soon they got their health care. It happens in all levels of the VA. Now they do get free health care, but it's not as good a quality as it could have been, I think. They certainly did earn it, and that's what was so bad about it. That's why I thought it was so bad that it was rationed like it was. The things I kind of as a parting thought, you know, there's lots of ways that I think that the government could make healthcare delivery better. I think the healthcare system is the best in the world. If it weren't, we wouldn't see... You wouldn't see doctors' offices in border towns bordering Canada full of Canadian license plates because Canadians come down here for their medical care, and it's the truth. If you've ever been to anywhere on the border of Canada, all the doctors' offices are full of Canadian license plates.
It'd be better with tort reform.
Absolutely, it would be better, but that's the point. They're not... The effort to take over the healthcare system is not about improving healthcare. If it were, they wouldn't do the things they're proposing. All the evidence suggests that those things that they're proposing will cause rationing, worse outcomes, and more government. Exactly. So therefore, it's not about healthcare, improving healthcare. It's not even about improving healthcare delivery. It's about taking over power, and it's simply a power grab, and that's what you've got to remember. And that's why you've got to remember liberty before anything. My final thought was that you know, there's a name for people who live under the government's care, who get all their housing, their food, their clothing, and their health care taken care of, and that word is inmates. So we don't want to be inmates. So I'd leave that with you. Thank you.
Good job. Thank you. It is an honor to be here today and see all of you. Tyler and I, we are Americans just like all of you. We love our country, we love our God, and we love our family. We did not come from wealthy families. We came from, our grandparents were both hardworking farmers. Our great-grandparents were legal immigrants. And, yay! But we had, because we live in this great land, we had the opportunity to be whatever we wanted to be. A doctor, and I'm a stay-at-home mom. I honor my forefathers for their sacrifice and for their hard work and for their values. They were humble people who also loved their country, their God, and their families. We are at a critical juncture where our freedoms are being threatened in the name of health care reform, just like what Tyler talked about. I hope that when my great-grandchildren look back at me, that they can say that I and all of you, like our founding fathers, stood and we fought for our freedoms. That we were not enticed by empty words and promises, and we were not seduced by socialism. That we fought for freedom and for the Constitution of the United States. Yes. I know that we will win because, like in the times of old, of our forefathers and our founding fathers, our cause is just, and in God we trust. So let us unite like we are. Let us speak out. Let us talk to our family, our friends, and our acquaintances. Let us know the issues and talk to them and encourage them why they must know the issues too. And above all, we must not fear. We must not fear the liberals' passionate threats or their mean-spirited names or their thugs, because we cannot be intimidated, and we will not be intimidated as we fight for our freedom. Thank you.
Good job. Thank you.